Gentlemen, if you're a man with nagging testicle pain or that horrible testicle pulling up into the groin feeling, you might assume that there's something wrong with your testicle.
Let's have a look at it. Oh, for God, heaven's sake!
But sometimes the real driver is actually higher up in the system, especially your abdominal wall and a small muscle called the cremaster. I'll explain how overactive abs and the internal obliques can trigger testicular discomfort and how this fits into the chronic pelvic pain model. And I'll show you some gentle, practical things that you can try: skin rolling, cupping, a hip flexor stretch, and some simple breathing strategies specific to testicular pain. Keep in mind, there are serious conditions associated with testicular pain, such as a varicocele, testicular torsion, epididymitis, or cancer. So, always follow up with an in-person family doctor appointment. But if you're watching this video and you've been medically cleared for serious problems, let's get into why you might be having some issues. Let's start with a simple picture of the anatomy so this all makes sense. At the top, you have your rectus abdominis, the external obliques. Underneath that, you've got the internal obliques. If we follow the continuation of the internal obliques, we can see how this tendinous portion feeds into this small hole called the inguinal canal. During development, as the testicles descend into the scrotum, they actually pull a sleeve of the internal oblique muscle down with them. That sleeve becomes the cremaster muscle, the small muscle that lifts your testicles up towards your body and lets them drop back down. So you can think of the cremaster as a continuation or an extension of your internal oblique into the spermatic cord and around the testicle. That means if your internal oblique and abdominal wall are constantly braced, tight, or over-recruited, that tension can feed directly into the cremaster and into how your testicle feels. This is why some men feel a line of discomfort that runs from the lower abdomen or groin along into the cord, into the testicle. It's one continuous myofascial and muscular chain. Keep in mind that near the region of the inguinal canal are three nerves: the genitofemoral, iliohypogastric, and ilioinguinal, and these can be a source of testicular irritation in men. If you haven't seen my video on the genitofemoral nerve, check out this video on my channel for an in-depth explanation. Now, what does testicular tension look like in real life? It might be fairly self-explanatory, but a lot of guys with chronic testicle pain or chronic pelvic pain have a habit of gripping through their abs and their pelvic floor. Maybe you've had back pain, a hernia, sports injuries, or you've just learned to brace your core constantly at the gym, and over time, that can become your default pattern, always on and never really relaxing. And when that internal oblique is always on, the cremaster can also become overactive. You might notice the testicle rides high, especially on one side. It pulls sharply with stress, cold, lifting, running, or during sex. You feel a tugging, burning, or aching into the testicle and the groin. And sometimes you might have to manually push the testicle back down because it's so uncomfortable. In some men, this sits inside a bigger picture of chronic pelvic pain syndrome, where the nervous system is more sensitive and the muscles of the pelvic floor and abdominal wall are guarded and overprotective. Nociplastic pain is a term we use when the pain system is turned up and more sensitive. Think of that like the volume knob on an alarm system, continually stuck on high. With chronic pelvic pain and chronic testicular pain, you might get overactive muscles, the abs, the hip flexors, pelvic floor, inner thighs, a fight or flight nervous system that's always slightly on edge, the brain predicting danger in that pelvic and testicle area and responding with more tension and more pain. So if your abdominal wall is always braced and your cremaster is always pulling, that continuous tension becomes one of the fuel sources for nociplastic pain. Part of treatment is not just looking for damage, but teaching the muscles and the nervous system that they're allowed to switch off again. This is where hands-on work, self-release, and breathing techniques come in. Now I'll walk you through a few simple ideas you can discuss with your medical provider or physiotherapist. These should be comfortable, gentle, and never forced. If anything increases your symptoms, back off and get individual advice. Skin rolling is a great way of gently mobilizing the skin and superficial tissues so the layers can glide better and the brain stops treating the area as fragile. Lie on your back with your knees bent. Start just above the pubic bone and onto the side of the midline. Gently pinch a small roll of skin and subcutaneous tissue between your fingers and thumbs. Slowly roll that skin fold between your fingers and move it a few centimeters at a time across your lower abdomen, towards the hip, up towards the belly button, and then into the groin areas as tolerated. Aim for a comfortable skin stretch or mild tenderness at most, not sharp pain or strong burning. Spend 2 to 3 minutes exploring both sides. Breathe slowly while you do it, and notice if certain areas feel more stuck or sensitive. You're not trying to mash the area, just reminding your system that this region is safe to move and touch. Next, if you have access to small silicone cups and your provider is okay with it, gentle cupping can also help desensitize that abdominal wall and improve that tissue mobility. Apply a bit of over-the-counter lotion or oil over the lower abdomen. Place a small silicone cup above the pubic bone or over the lower internal oblique region, between the hip bone and the belly button. Squeeze to create a mild suction. It should feel like a gentle pull, not a bruise level vacuum. You can either hold the cup still for 30 to 60 seconds or slowly glide it a few centimeters at a time, staying away from obvious scars or areas of strong discomfort. Now repeat this for 3 to 5 minutes, then remove the cup and recheck how the area feels with light touch and movement. Next, let's involve the hip flexors and your breathing pattern, because both can drive pelvic and abdominal tension. Step 1, get into that split lunge position. Gently tuck your pelvis under. Think zip up your pubic bones towards your ribs until you feel a light stretch in the back leg of the front of the hip. Keep your ribs soft and avoid arching the low back excessively. Hold this for 30 to 45 seconds while breathing in slowly in and out. Then switch sides. You can repeat this for 2 to 3 times per side, staying under a 3 to 4 out of 10 for the stretch sensation. We don't want to try to aggressively stretch the muscle off the bone. Next, breathing is one of the most powerful ways to dial down chronic pelvic pain because it affects both the abdominal wall and the nervous system. Lie on your back with your knees bent or sit supported. Place your hands on your lower abdomen. Breathe in through your nose for about 4 seconds, and as you inhale, let your lower belly gently expand into your hand. Think of the lower abdomen softening and widening, not bracing or straining. As you inhale, imagine the pelvic floor and the area around the testicles gently dropping and widening. Think of it like a parachute opening instead of pulling up. Exhale slowly through the mouth for about 4 seconds, letting the belly fall and the pelvic floor and the cremaster stay soft. Repeat this for 3 to 5 minutes, and you can do this especially before bed or after triggers like a workout or a long day of tension. So to recap, gentle strategies like skin rolling, cupping, hip flexor stretching, and breath-based relaxation can help your abdominal wall and pelvic floor learn how to switch off again. If you found this useful and you want more content on men's pelvic pain and chronic pelvic pain syndrome, feel free to hit that like and subscribe button and leave a comment with what you'd want me to cover next. Thanks for watching.